How does cluster detection and response work help end the HIV epidemic in the South? As we discussed in the previous videos, identifying an HIV cluster as quickly as possible is crucial so that people in the cluster and others in their networks can access HIV diagnosis, treatment, and prevention services. That is why cluster detection and response (CDR) work is integral to ending the HIV epidemic (EHE). The federal Ending the HIV Epidemic initiative focuses its efforts on 57 of the United States jurisdictions where over half of new HIV diagnoses occur. The initiative aims to reduce new HIV infections in the United States by 90% between 2019 and 2030. Of the 57 jurisdictions, 6 of the 7 EHE states and almost half the EHE counties are in the South. The EHE initiative has 4 pillars: diagnose, treat, prevent, and respond. The first pillar is diagnose. Diagnose all people with HIV as early as possible. HIV CDR work focuses on networks with rapid HIV transmission so that people with HIV can be diagnosed and promptly begin care and treatment, such as taking antiretroviral therapy, ART. The second pillar is treat. Treat people with HIV rapidly and effectively to reach sustained viral suppression. Identifying people with HIV in a cluster who need assistance linking to effective treatment and care will keep them healthier and prevent further transmission. The third pillar is prevent. Prevent new HIV transmissions by using proven interventions, including PrEP, pre-exposure prophylaxis, and SSPs, syringe service programs. Along with helping people in networks experiencing rapid transmission get on PrEP, this pillar can involve identifying potential areas for improvement in a health department's prevention program to minimize future transmission. The fourth pillar is respond. Respond quickly to potential HIV outbreaks to get vital prevention and treatment services to people who need them. Giving CDR work its own pillar emphasizes how integral it is to ending the HIV epidemic. Successful CDR efforts improve testing, treatment, and prevention services for individuals in HIV clusters and their networks. Improving services can make them more accessible and intentionally root out stigma within them. The continued success of CDR programs also relies on regularly soliciting community input. For example, a mobile testing unit may be a perfect tool for a community where access is the most significant issue. But for other communities where distrust is a larger problem, this type of intervention may instill fear in people who need care the most. Additionally, the broad nature of CDR work helps connect community members with services beyond just HIV-specific ones, such as overdose prevention and insurance assistance programs. It highlights which full-spectrum services community members may need to stay engaged in HIV medical care. CDR work helps reduce HIV transmission in communities that existing services aren't effectively reaching. Ultimately, it sets health departments and CBOs up to meet EHE's goal of reducing new HIV infections in the United States by 90% by 2030.